I had the physician ordered an NG tube, so I'm going to gather my supplies and go in the patient's room. So come in, knock, 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 introduce myself to the patient, get 2 forms of identification, and tell him what I'm going to do to help with his stomach. And I'm going to wash my hands, put my gloves on.
You do that as prepping your medicine, right? Or you might do that when you actually come to the room.
While you're there's actually this device. They would fill the tube and then drop the saline and then you go. This is the second time it's done.
Why did I dry my hands? Sorry.
So that would be in your prep stage.
Okay. He's already in the high Fowler, so I don't have to reposition him. So I'm gonna cover him up. Okay. I'm gonna occlude one nostril at a time to see which which nostril is the best. Left and right, and check his oral cavity. And then going to measure from the nose to the ear down to the xiphoid process, and I'd mark it. In this case, there's numbers on here, so I know it's 50. And so I'm going to lube the first 4 inches, and I'm going to have him put his head back and insert the tubing a little bit. Then after I've inserted it far enough, I check his oral cavity and I see it, and so now I'm going to have him lean his head forward and swallow, and every time he swallows, I'll put a little more in until I get to my mark. And once I get to my mark, I have him speak, and so I'm going to temporarily tape it to here, and I want to check for correct placement. So I'm going to aspirate 30 mLs, and I see it's green gastric acid content, and so I'm going to, when I reinstate it, I'm going to listen for gurgling. So I hear gurgling, so I know it's in the right place. I'm going to remove this, connect it to the suction, and then I'll permanently tape this to his nose, and then I'll pin it to his shirt as well. And then I'll make sure he doesn't need to go potty, isn't in any pain, and lowest position, and has all of his possessions. And then I can clean up my supplies. And then I'm going to go document the tubing, the suction, what the stomach contents look like, and I think that's it. And then I'm going to come back a little while later, and I'm going to remove it from the suction, and I'm going to aspirate again to, bless you, to check for correct placement again. So I aspirate 30 milliliters, and when I reinstate it, I see the green stomach content. When I reinstate it, I listen for gurgling. Okay, hear gurgling, so I know it's in the right place. Remove that, and then I would get another tube, and I would put 30 mLs of sterile water in the tubing, and I will inject the 30 mLs. And then I'm going to aspirate again to see how much I get out. Should be a mixture of water and the gastric contents. So I can see it's still in the right place. So I'm going to resuction, make sure everything looks good, and I discarded this somewhere else. And And then I make sure if he's in any pain, he needs to go to the bathroom, lowest position, and he has his possessions. And then I clean up my supplies and document the tubing, the suction, what came out, or the difference between what I put in and what came out. And that's it. Pause it.